Greetings. I'm Dr. Kim Yong-won of Online Surgery. Let's look at a surgical video clip today as well. The patient of the day panoramic image. It is at initial visit. The patient is 59-year-old female patient, and at initial visit, number 47 was missing. It's been quite a while since it was missing. Number 8 is mesially tilted and antagonist is erupted. On the other side, in upper and lower, in number 7, there's root rest. The reason why the treatment was delayed was because the patient was diagnosed with osteoporosis and she received the injection every 3 months since November 2019. The patient's last injection was at the end of January 2021. It's been approximately 1 year and 4 months. The patient received 5 to 6 injections, bisphosphonate. That's why private practitioners were reluctant to take on that patient, and the patient came to me. At this stage, it's been approximately, the entire period was 1 year and 4 months, so this is not a significant amount of time. There's little possibility of bone necrosis, but I recommended drug holiday. I had the patient forego the injection in April, and extraction was to be done in May or June. If the healing had no problem, I decided to move forward with implant treatment. In June 29th, on the left, number 27 and 28 and 37 were extracted. Healing was done nicely and the patient felt more comfortable. Number 47, implant was planned. The antagonist was erupted. We used orthodontic screws to impact it slightly. That was incorporated in the plan. In number 18, extraction was done. Orthodontic screws were used in September 14 to impact the tooth, and power chain application was done. In November, I checked the orthodontic progress and implant was placed. There was in June. As you can see, the antagonist is erupted. If you look at patient image number 17, it is quite erupted. If you provide implant in this state, the crown can be smaller. There's occlusal step, so it's not very favorable. I used orthodontic screws on the buccal and palatal side, used power chain to do orthodontic treatment in number 17. I looked at the orthodontic treatment's response and then planned for implant placement. As I placed orthodontic screw, I took a CT. I carefully placed the orthodontic screw so that it is not harming the adjacent teeth. In number 18, extraction was done. Extraction socket can be observed in the lower, in the area where implant is going to be placed. It was missing for a significant period of time, but I don't see significant alveolar bone atrophy, so I don't believe the surgery itself will be difficult. I'm going to use one guide for the surgery. Surgical report was generated, and this is the plan. I decided to use KS3 implant 5 by 8.5. That was the plan. This is November 9th before surgery. As you can see, compared with before, the antagonist is quite impacted and there's sufficient occlusal clearance. Number 7 is slightly more inferior than 6, but it's not going to be a problem. Surgery was done. This is post-op X-ray. As planned, KS3 diameter 5 by 8.5 implant was placed. Primary stability was sufficient. Healing abutment was connected. In post-op CT, you can see that implant has been placed in the desired position. There's no problem here. In September, this is when orthodontic treatment was yet to be provided. In December 2021, before prosthesis was delivered, you can see that 2 orthodontic screws were placed, and with the power chain, the super eruption was resolved, and there was no problem in delivering prosthesis. This is after prosthesis delivery. Because the erupted tooth was repositioned, the relation with the antagonist was good and occlusion was well formed. This is panoramic image after final delivery. The relation with adjacent teeth and prosthesis has been completed nicely. Let's look at the surgery. Today's surgery uses one guide. I believe the surgery itself will be simple. Before we go in, you can see the orthodontic screw on the palatal side. I'm checking whether the template fits well. You can see that there's no problem. Tissue punch is used to remove the gingiva. This is a wide hole. You can use the wide one, which is the gold one. Tissue punch is used to remove gingiva. Guide is removed. I'm checking once again whether the tissue punch has been done properly, and now I'm adapting the one guide template. Initial drill is used to make initial hole. You can see that I'm going in full length. Through pumping action, I am preventing any heat from being generated. 3.5 by 8.5 one guide drill is used to form the hole. This is being done without a problem. Pumping action is used so that saline can go in to prevent heat generation. 5.0 by 8.5 one guide drill is used to do final drilling. KS3BA surface is used. This is a hydrophilic surface. You need to irrigate it sufficiently using saline. And now I'm going to position the implant. Using engine, I've placed it approximately 80%, and then using implanted driver, torque wrench is used to get the final position. I am finding the slot, and to the desired depths, I am positioning the implant. The primary stability is good. It is over 30 Newton. This is posterior area. I'm using a mirror to check the position and depths. ISQ value is approximately 73. Primary stability is sufficient. Healing abutment is connected, and surgery is now complete. Today's surgery was about placing implant using one guide in number 47. The surgery itself was quite simple. The reason why I prepared this video is because If the tooth has been missing for a long period, antagonist can be erupted and partial orthodontic treatment was provided using orthodontic screw to get a more ideal occlusion after implant placement. That was why I chose this case. Thank you for watching.